Well, South Africa is back in lockdown level 3. In case you missed the details of last night, there's a number of regulations that have changed. In case you missed the president's speech last night, you can go and rewatch it this morning on eNCA.com. This announcement made as COVID-19 numbers continue to surge, someone even saying spiking. The second wave of infections does appear to be driven by a new and more infectious variant of the virus. Well, at least that's the question that we're starting to unpack. And to help us do that and get some reaction on this latest announcement, this latest family meeting, I'm joined by medical expert Dr. Aslam Dasu. It's always a pleasure speaking to you. Dr. Dasu, first of all, we will discuss the vaccinations in a moment. I would like to ask from you, though, your thoughts on these new regulations that have come in. I think many people do understand it, but there seems to be some confusion. I'd like your take on this. Do you think we've gone into a level 3 lockdown again because South Africans aren't behaving, or because we don't understand this new strain of COVID-19, which seems to be more aggressive? All right, I think we have lost the audio from the doctor. Oh, there we go. Doctor, good morning. Sorry, I actually didn't have you for a couple of moments. I hope you heard my question. Could you perhaps restart, if you don't mind? I think your microphone is off for a moment. My apologies.
Sure. Good morning. Look, there's all of these levels of lockdown, have played some role. They're very mechanical, though, and the collateral damage emerging from the various levels we're all aware of and are very undesirable. It's almost as though we take a step forward and 2 steps back. The president, about a week or 10 days ago, I think made it very clear that we are attempting, or the government is attempting, to target specific areas where the resurgence is most acute. Going to a level 3 lockdown like this is perhaps harsh, but we are clear that this surge is really from these gatherings that we are seeing across the country. And prohibition on those gatherings, as someone put it, prohibit the parties, the pubs, and the pulpits in order to get a handle on this, is probably what was top of mind for the president yesterday, who made it very clear that, and I agree, we're at a very dangerous moment. That said, we are also quite alarmed, and it is very disturbing that there's such a lack of information about really the only instrument we have in our toolkit to manage the pandemic, vaccines, which are now increasingly available, but not to us in good enough time. To only push it out to the second quarter of next year is frankly unconscionable, when countries like Egypt and Morocco and Chile and Peru and other developing countries smaller than us have already secured supplies of vaccines. So there is a huge conundrum here that we're facing about why this reticence around vaccines.
Dr. Dasu, are you able to elaborate on not the details of how a vaccine is brought into a country, but the reasons behind why it could be taking so long? Is this got to do with the payment being made late? Is this a case of we don't know how to put this vaccine out into the public? Is this poor management? Is this a case of government just left it far too late, do you think? Because it's not just the issue of when this vaccine is going to arrive, but it's also another quantity. We just had Jesse Duarte saying it's going to be enough for 10% of the population. So everyone's getting very excited, or they were for the first quarter. Now we're getting less excited for the second quarter. And now we're being told it's only going to be enough for 10%. It could be a year before anybody in the public space actually gets this vaccine. Any idea whatsoever that what could be causing this delay?
Look, I think you've captured it well in your question. I think the anxiety is developing because there's such a lack of information. And all the reasons you mentioned that could possibly be causing this are all possible. We don't know why this is the case in South Africa. The COVAX facility, just to put people in the picture, is a group facility. Many, many countries are in that facility. And South Africa has now entered, it made its deposit with a grant from the Solidarity Fund. But this puts you in a queue for vaccines, the amount of which and the types of which you are not in control of. And, of course, if we are talking about just 10% or less, that's certainly not sufficient to give us population-wide immunity. But it's what it is. Bilateral negotiations with pharma manufacturers who have produced all the other vaccines, AstraZeneca, Pfizer, and Johnson & Johnson and others, these are being trialed right here in our country. We have access to these companies, and it really surprises me that we haven't secured sufficient doses for ourselves in this time. So it's very hard to say why we don't have it until we have more information, but it is dangerous for our economy, for our people, and particularly for our health workers not to have it. Let me just say this. If our health system is getting overwhelmed, as signs are that it is, it's our health personnel who are breaking down. They are getting infected, they are getting sick, and they are dying. And they are not replaceable, leaving the burden then on the remaining health workers together with the surge. So one has to understand if this is the bulwark that keeps our country stable during a pandemic, that we have to protect it. And I'm just astonished that we haven't secured vaccines, at least for the health workers in the country.
I think you stole the words right out of my mouth. The word astonished might be just too diplomatic a way of putting it, Doctor. Just a final question to you, and I'm so glad I'm speaking to you as a medical expert, because I'm seeing this question being asked on social media a lot, and I was wondering the same thing. If we're now only going to get 10% of the vaccine by possibly winter at the latest, second quarter of next year, what happens with this new COVID-19 strain? This vaccine is for the one that we dealt with earlier, this new 501.V2. I'm not even sure how you say it, version 2. Does this new, or the vaccine we're going to get, is it going to cover this latest strain? How does this work exactly?
Okay, so it's not surprising that there's a variant in the virus. This is how viruses exist in the world. As they reproduce, mutations develop and variants emerge, as we have identified the one now. It is, however, too late to try and stop its spread from around the world, as countries are trying to do. It's like closing the stable door after the horse has bolted, because these variants emerge at different times and circulate. So it's very important to understand that, as far as we know, there is no definitive study that shows that it is more transmissible, although anecdotal information suggests that it is. We have no information yet that it's more virulent, that it can cause more severe disease, but there's research underway. And we have no indication that the current vaccines developed are going to be affected, or rather become ineffective against this variant. That being said, we have only the measures, the mitigation measures that have been in place that everyone should be aware of, the masking, the distancing, and so on, that works even for this variant. So there's no getting away from that. We just have to continue with that approach as best we can until we get vaccines, which is the only instrument that gets us to population-wide immunity and beyond the pandemic. Every focus must now be on acquisition of the vaccines, and in the first instance, vaccines for the frontline health workers. The COVAX facility is all well and good. It'll only give us a certain amount of vaccines. We need vaccination to get 60 to 70% of the population immune. This is a basic minimum. And had we, and I'm surprised we haven't, had we been like other countries, we would have achieved that goal within the first half of next year, not waiting first in that period to get our first batch of vaccines.
I couldn't agree with you more. The time for excuses is over. We need this vaccine in South Africa. Dr. Dasu, you've asked and answered many questions South Africans have this morning. I want to thank you for your time and speaking to us here on eNCA. Medical expert Dr. Aslam Dasu, reacting not just to the COVID regulations, but also to the vaccine, the super spreader events, and making it very clear what he thinks about government's approach on why it is taking so long to get this vaccine. It's now second quarter of next year. But